Have you ever felt like your heart suddenly turned into a drummer at a rock concert? Thuk, 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 without your permission? Or maybe like a DJ scratching records inside your chest? That, my friends, is what we call palpitations. Now, before you panic and think, oh no, am I dying? Relax. Palpitations are super common. In fact, almost everyone has experienced them at some point. But sometimes they're just harmless. And sometimes they're your body's way of saying, buddy, check under the hood. Today, on DocDecoded, we're going to decode palpitations in plain, simple language. What they are, why they happen, when to chill, and when to run, well, not literally run, to the doctor. Palpitations can be described as a feeling of your heart thumping, pounding, or fluttering, like a bird trapped inside the chest. This feeling may come and go, intermittent, or stay for some time, sustained, and the heartbeat can be regular or irregular. In simple words, palpitations are the feeling of your own heartbeat. Normally, your heart beats about 60 to 100 times per minute quietly, without you noticing. But when you suddenly become aware of it, whether it's beating too fast, too slow, irregular, or even skipping a beat, that's what we call palpitations. Or it's pounding hard, like you just ran a marathon, even though you're just sitting on the couch watching Netflix. Here's a catch. There is difference between fast beating and palpitation. Watch the full video on Tachycardia on I button. Most people notice palpitations as an unusual awareness of their heartbeat, especially when they feel like their heart has skipped or missed a beat. Palpitations are often felt more clearly when you're resting quietly, since there are fewer distractions. Funny thing is, sometimes the heart is actually beating normally, but our brain just becomes extra aware of it, like it turned on a spotlight. Attention, ladies and gentlemen. Here's your heartbeat. Okay, now let's ask the big question. Why does this happen? Palpitations can have many causes. Your heart, 43%, mind, 31%, miscellaneous issues, 10%, and sometimes, well, nobody knows why, 16%. Well, there are two broad categories of causes. Harmless ones and the more serious ones. Let's break them down. Harmless or everyday causes. Stress or anxiety. Ever noticed your heart pounding before an exam, interview, or first date? That's not love. That's adrenaline. Caffeine overload. Too much coffee, tea, or energy drinks can make your heart race like it's on Red Bull literally. Exercise. Totally normal. If your heart didn't beat faster when you're running, we'd be worried. Lack of sleep. Your heart likes rest too. Hormonal changes. Pregnancy, menopause, all can play with your heartbeat. And yes, things like tobacco, aminophylline, atropine, thyroxine, cocaine, and amphetamines can all add to the chaos. Basically, anything that revs up your heart too much can make it dance to its own beat. These should be under check. Now, here's where it gets a little serious. Palpitations can also happen due to underlying heart conditions like, among heart-related reasons, common culprits include premature atrial or ventricular contractions, supraventricular or ventricular arrhythmias, or irregular heartbeat. Heart valve issues like mitral valve prolapse, aortic insufficiency, atrial myxoma, myocarditis, and even pulmonary embolism. Even an enlarged ventricle from aortic regurgitation can make your heartbeat feel like a mini earthquake in your chest. There is quite a long guest list for one symptom. If palpitations change with body position, like lying down or turning, they may be due to a structural problem inside or near the heart, such as an atrial myxoma, a heart tumor, or a mediastinal mass, a growth near the heart. When palpitations come and go, it's often due to those premature beats. Basically, your heart throws in an extra beat for drama. After this pause, the next beat hits harder, making you aware of it. Interestingly, not all arrhythmias cause palpitation. Some sneak by silently. When they do occur, doctors often ask patients to tap out the rhythm they feel or check their pulse during the episode. Yes, your doctor might ask you to play a little drum solo on the table. Then there are the miscellaneous causes, a mixed bag of reasons such as conditions like pheochromocytoma, where adrenaline goes wild, a rare adrenaline-producing tumor, anemia, low hemoglobin, electrolyte imbalances, too little potassium or magnesium. Thyroid disorders, thyrotoxicosis, an overactive thyroid making your heart race. Systemic mastocytosis, a condition with too many mast cells. So basically, palpitations can be as innocent as I drank too much coffee, or as serious as my heart's electrical system needs a mechanic. Sometimes, palpitations don't come from the heart itself. They come from the mind. Conditions like panic attacks, anxiety disorders, or somatization, when stress shows up as physical symptoms, can all make you feel your heart racing or pounding. People with psychiatric causes of palpitations often say the feeling lasts longer, usually more than 15 minutes. And they may also experience other symptoms like chest tightness, breathlessness, or dizziness. When should you worry? All right, now the million-dollar question. When are palpitations dangerous? Here's a simple rule. If palpitations are occasional and short-lived, they're usually nothing to panic about. But if they come with other symptoms like dizziness, fainting, chest pain, shortness of breath, or if they last a long time, then it's time to see a doctor. Because these could signal a more serious heart problem like arrhythmia or heart disease. So don't just Google why is my heart beating weird and self-diagnose. If in doubt, get it checked. Google won't give you an ECG, your doctor will. So whether it's stress, thyroid, or too much caffeine, your heart may not always be the troublemaker. Sometimes it's just reacting to the chaos elsewhere. How do doctors check palpitation? If you land up in a doctor's clinic saying, my heart's racing, the doctor's first job is to find out if it's just anxiety or an actual arrhythmia, an abnormal heart rhythm that can sometimes be serious. History and physical examination. They'll ask, when do you feel it? How long does it last? What triggers it? If palpitations come with fainting or lightheadedness, it's a red flag that the heart's not pumping enough blood. And if there's chest pain or breathlessness, it might point to things like aortic stenosis, hypertrophic cardiomyopathy, or ventricular dysfunction. Basically, the heart's saying, I'm working too hard here. During examination, doctors check your pulse, blood pressure, neck veins, and heart sounds, like a mechanic listening to an engine misfire. Accordingly, they may suggest ECG, electrocardiogram. Think of it as a lie detector test for your heart's electrical activity. An ECG is a go-to tool to catch the rhythm problem in real time. If the palpitations happen only during exercise, we use an exercise ECG, treadmill test. Holter monitor, a small device you wear for 24 to 48 hours to catch those naughty beats. If the problem plays hide and seek, we use Holter monitoring, continuous ECG for 24 to 48 hours. Telephonic monitoring, patient-triggered ECG, or even loop recorders, tiny devices that spy on your heartbeat long-term. Blood tests to rule out thyroid, anemia, or electrolyte issues. Echocardiogram, an ultrasound to check your heart structure. People with coronary artery disease, CAD, or risk factors for it are the ones we watch most carefully. Their palpitations might mean ventricular arrhythmias, which can be dangerous. Basically, the idea is to find out whether it's just a harmless flutter or something that needs fixing. In short, when your heart skips a beat, don't panic yet. It might just be stress, or it might be your heart's way of saying, book me a checkup. The most patients don't have any serious arrhythmia or structural heart disease behind them. Sometimes it's just benign premature beats, tiny misfires of the heart, that can be easily calmed down with beta blockers. Now let's talk about what you can do if you experience palpitation. If your palpitations are triggered by alcohol, smoking, or certain drugs, the cure is pretty simple. Don't do the thing. Cut down caffeine and alcohol. Sorry, coffee lovers, but 5 cups a day is not heart-friendly. Manage stress, meditation, yoga, deep breathing. These are not just Instagram trends, they really help. Stay hydrated. Dehydration makes your heart grumpy. Get enough sleep, at least 7 to 8 hours. Check your medication. Some medicines like asthma inhalers or decongestants can trigger palpitation. If they're due to medications, your doctor might tweak your prescription. And if it's more of a psychiatric or anxiety-related cause, cognitive therapy or mild pharmacotherapy can help. And here's a fun fact. Sometimes, Just taking a deep breath and coughing can reset your heart rhythm. But hey, don't overdo it. This isn't a video game with a reset button. Let's keep this crystal clear. Call your doctor or emergency services if palpitations are accompanied by chest pain, making you faint or feel like fainting, happening with severe shortness of breath, or if you have a known history of heart disease. That's not the time to sit and sip water, hoping it'll pass. That's the time to act fast. Doctors also recommend keeping a palpitation diary or using a small electronic marker. Basically, noting when your heart acts up helps decode the pattern. Bottom line, once serious causes are ruled out, palpitations are usually just an annoying guest, not a dangerous one. So breathe easy. Your heart's just being dramatic, not dying. If you found this video helpful, don't just let your heart do the talking. Show me some love by liking, sharing, and subscribing to DocDecoded. New videos every week where we simplify medicine into plain everyday language. Your health decoded, one heartbeat at a time.